Good evening, everyone, and welcome to I Care and You 30. Today's webinar is all about macular degeneration, and I'm delighted that we're joined by Sarah Clinton from Macular Society, who will be delivering our presentation today. Please, can I remind everyone to be muted and keep your videos off just for the duration of the presentation. There will be opportunity after the presentation to ask your questions. Feel free to pop them in the chat, or you can unmute or raise your hand after the presentation and we'll go through your comments and questions one by one. So please, can I invite Sarah Clinton to introduce herself and start the presentation?
Thank you. Yes. So yes, I'm Sarah Clinton. I'm the Patient Information Officer at the Macular Society, and today I'll be talking about age-related macular degeneration. So many people who get diagnosed with AMD, the first question really is what is it? While it's the biggest cause of sight loss in the UK, unfortunately, it's not very known in the general population. Age-related macular degeneration, or AMD, affects people more as they get older, usually affecting those over 50. It only affects the central vision, so even as the disease progresses, your peripheral vision will remain with AMD. That's something we like to make sure people are assume that when you are diagnosed with a sight loss condition that will affect the entirety of your sight, but with AMD that's not the case. And AMD can affect one or both of your eyes. So AMD affects the macula, and the macula is found at the back of the retina, in the back of the eye. So it's only about 5 millimeters across, but it's responsible for all of our central vision. It's also responsible for our color vision and for fine detail. It has the highest level of photoreceptors in the retina, and photoreceptors are light sensing cells which sense light and send information to the brain to be interpreted as vision. So it's an incredibly important part of the eye, responsible for our central detailed color vision. So what are the risk factors for developing AMD? The cause of AMD is unknown. We believe that there are many different factors for developing and progressing AMD. One of the main factors for AMD is it's inflammation, which is a big part of and big risk of AMD. But there are some factors that have been associated with the development and progression. This includes age. As the name suggests, it's an age-related condition. At around 60, 1 in 200 people will have AMD, which then increases to 1 in 5 by the age of 90. Genetics also plays a big role. We often hear when talking about genetics that which it means that there might be a family history of developing AMD. When we speak to people with AMD, sometimes they realize that maybe one of their parents had AMD, but maybe that wasn't as well known or understood at that time. It also means that those with AMD might have a higher risk of their family members, such as their children or grandchildren, developing AMD as they get older. So that's something we always like to mention, and there are things that people can do if they've got a higher risk of developing AMD to reduce that risk as they get older. So that's when the modifiable risk factors come into place. So smoking is the biggest modifiable risk factor for developing AMD. Smokers are up to 4 times more likely to develop AMD than non-smokers. We recommend that people who do smoke to stop smoking if they have got a risk of developing AMD, and also if you've been diagnosed with AMD, because Smoking also increases your risk of progression and fast progression of AMD. Diet and has also been found to have to play a role in the development of AMD, and there are a number of different ways that that's the case. So with diet, what we recommend for people with AMD or who are at a risk of developing AMD is a wide variety of fruits and vegetables which are rich in antioxidants. Antioxidants and other minerals and vitamins in fruit and vegetables protect the body against inflammation, and in particular something called free radicals. These are unstable molecules that damage cells and stop cells repairing themselves. So they have a really important role in the eye. Things that have been shown to have a beneficial effect on AMD is the Mediterranean diet, rich in oily fish and in particular rich in green leafy vegetables. So there are a certain group of antioxidants called carotenoids, and in particular the two carotenoids called lutein and zeaxanthin. Lutein and zeaxanthin are naturally found in the macula and what we call macular pigment, and they protect the macula from damage. So again, there's another really important part of the diet and nutrients. So we recommend diet high in these carotenoids. So and this can mainly be found in green leafy vegetables as well as eggs and carrots and orange peppers, things like that. So kind of very colourful diet rich in fruits and vegetables. Supplements have also been shown to slow the risk of slow AMD progression in some people, and in particular a group of supplements called AREDS2 supplements. So that's AREDS. This stands for age-related eye disease study. This AREDS trial took place a number of years ago now, and it looked to test whether supplements, and in particular supplements containing vitamin C, zeaxanthin, and zinc, whether these supplements could slow the progression of early and intermediate AMD to late stage AMD. And the results did show that they were able to slow the progression of AMD as well as slow the damage to the macula with AMD. So these supplements contain high levels of vitamin C and E, as well as the antioxidants called carotenoids. These supplements are often available on our local high street opticians. There are often many macular supplements or eye supplements available in on the shelves in pharmacies and on high street. But it's important to make sure that when buying these supplements to look to see whether they are AREDS compliant or whether they follow the AREDS formulation. I have this on the screen, and you can also find more about that on the website or on our website or online to just make sure that it is AREDS compliant, because those are the supplements that have some proven benefit or some proven evidence to slow AMD progression. So I've been talking about AMD progression. So it is a progressive sight loss condition, AMD. It often starts off with early AMD, which can then progress to intermediate AMD, and then finally late stage AMD. There are two different types of late stage AMD. We have wet AMD and geographic atrophy. These two types of late stage AMD can occur together or separately. People might have one type in one eye and the other type in the other, and they can also occur in the same eye. So in one eye, you can have symptoms of both wet AMD and geographic atrophy. And I'll discuss more about what those two are in just a minute. And it also means that if you have one condition, you also could develop the other type. It's not kind of, as so many people think that if you've got one type, you won't get the other, but that's not the case. You can have both. So what are the symptoms for AMD? There are several symptoms associated with AMD. These often start with kind of colours looking duller. As I mentioned earlier, the macula is responsible for our colour vision. So colours often start to look duller to begin with. People might notice difficulty in low light and have trouble with glare. Things like street lights or car headlights can cause glare, especially in dark conditions. And there may be some difficulty adjusting to different lighting. AMD can also cause blurred vision, distortion, where straight lines start to look wavy or bent. And finally, with late stage AMD, people might notice patches of vision loss, which are called scotomas. On the right here, if people are able to see this, I've included a picture of an Amsler grid, which is a series of lines, both horizontally and vertically, with a dot in the center. These grids are available often in paper copies, available from the Macular Society and from many other different places, such as the local opticians and eye clinic. And these Amsler grids can be really important to help monitor vision and monitor your symptoms with AMD. The idea is that you hold the grid about an arm's length away and test each eye individually, closing one eye and looking at the other. And you look at the dot in the middle and you want to look for changes in vision, where if any lines are wavy or bent, or if there's any patches of sight loss or vision loss. So we recommend that you do this kind of every week or every fortnight to understand what your vision looks like, and then so you can pick up any changes that might happen over time. And if we can pick up changes, then we might be able to get treated. We might be able to spot if any changes occur that can then lead to treatment. So this is another slide again showing the progression of vision loss. It starts off with all pictures of a young girl being held by her mother. You can see what it looks like with normal vision, where it looks kind of crisp and clear image. And then as AMD progresses, the colours start to look duller and there start to be some blurring on that picture. And then with late stage AMD, there is that patch of vision loss. So that's scotoma in the center of the vision. So how is AMD diagnosed? There are a number of different tests that are used to diagnose AMD. The most common one is what we call is an OCT scan, which stands for optical coherence tomography. So these scans are available in eye clinics and are now becoming more and more frequently available in high street opticians. So when people you may be offered it when you go to get a standard eye test, often about an extra 10 or 20 pounds to have these OCT scans included with your standard eye test. The OCT scans look and take many different pictures of the macula in very fine detail. So we're able to see the macula up close and in different orientations. We're able to really see what the health of the macula looks like. Eye charts are also used for diagnosing AMD to see how the vision is being affected with AMD. So again, if you've gone to an eye clinic or to an optician's, you may be familiar with the eye charts. They start off with very big letters at the top, which slowly gets smaller as you read further down. And the most common one is something called a Snellen chart. And again, that's used to help monitor vision and to notice any changes in vision over time. There are other scans that might be used to help diagnose AMD, scans such as fluorescein angiography, which might be used to diagnose in wet AMD. So going back to the different stages of AMD, AMD often starts with early AMD. With early AMD, often there are no symptoms, but it can be diagnosed when people go to see opticians. As I mentioned just a second ago, opticians now more and more frequently have OCT scanners and are offering OCT scans with a standard optician's appointment. So this means people are often being diagnosed with AMD earlier and more frequently. So when opticians or people look at OCT scans with patients with early AMD, they might start to see small drusen in the macula. Drusen are small waste buildup that accumulates in the eye and in the macula. Usually macular cells are able to recycle components of the cells and waste that gets built up over time. When cells become damaged or are no longer working as well as they used to, this waste can build up in the macula and be seen as drusen when we look at the macula. So these drusen are the earliest signs that there are some changes happening in the macula, and the macula isn't quite as healthy as it used to be, and there may be a sign of aging of the macula. With intermediate AMD, these drusen get larger and more frequent. And again, it's a sign that there is something that the macula isn't healthy or isn't as healthy as it used to be. And this might be when we start to notice changes in vision, particularly kind of changes in that low light vision or small patches of distortion. AMD can progress to geographic atrophy or late stage dry AMD. So geographic atrophy is the medical term for late stage dry AMD, and it's a term we're starting to use more frequently. Previously, and still now really, patients will get told that they have dry AMD. However, dry AMD can really mean any type of AMD that's not wet, both early and intermediate AMD. So as we're starting to see treatments for late stage dry AMD, we're starting to see the term geographic atrophy being used more, because this is a much more precise term and is able to pinpoint the stage of AMD that a person has. Geographic atrophy gets its name from damage or atrophy in the scientific terms. Patches of damage occur in the macula that look like islands on a map. And again, that's where the geographic term comes from. With geographic atrophy, areas of the macula become damaged and stop working as the cells or patches of cells start to get damaged or die. And geographic atrophy is a progressive condition and it causes progressive vision loss. So usually over a number of years, vision loss continues, or kind of vision loss develops over a number of years. The other form of late stage AMD is wet AMD. This is often discovered after a sudden change in vision. Often causes a sudden loss of vision. This is due to blood vessels growing and leaking under the macula. Fluid accumulates in the macula and disrupts the cells of the macula, which can lead to scarring. There is treatment available to stop these blood vessels growing and leaking and the fluid building up. Treatment often begins with people do notice often an improvement in vision straight after treatment, where the fluid and the blood vessels are being removed from by the treatment. But over time, the treatment for wet AMD looks to stabilize vision to stop vision loss. Treatment for wet AMD typically involves injections into the eye, which are called intravitreal injections. And they're treated with a group of drugs called anti-VEGF drugs. That stands for anti-vascular endothelial growth factors. Currently in the UK, we only have treatment available for wet AMD. There are several approved drugs for wet AMD. More common ones are Eylea, which is scientifically called aflibercept, Lucentis, which is called ranibizumab, and Vabysmo, which is called faricimab. These drugs need to be given on a regular basis, usually every month to every 3 or 4 months, which depends on what drug you're on and how you respond to treatment. Typically, when patients begin treatment for wet AMD, they'll start with 3 or 4 months of monthly injections, and then depending on how they react to treatment, they may be extended a couple of weeks at a time, depending on how well you're responding to treatment and whether any fluid comes back after treatment. Typically, people can go about 2 to 4 months between injections if they've got a treatment that they respond well to. Over the last few years, we've been quite fortunate to get some new approved wet AMD treatments, which are longer acting, which means that patients don't have to have as many injections or have to have injections less frequently. It also means that the eye clinics can help the eye clinics not be so busy. Unfortunately, with so many people being diagnosed with wet AMD, needing treatment on a regular basis, some eye clinics can get incredibly busy trying to treat all of their patients as often as they need to be. So having longer acting injections is really, really fortunate for that. For future treatments, there are many trials underway in the UK and worldwide looking for new treatments for both wet AMD and also for geographic atrophy. There are 2 drugs currently going through approval process to be approved in the UK for geographic atrophy. These are called Syfovre and Izervay. Both Syfovre and Izervay are injections into the eye every month or every other month. and they look to stop inflammation in the back of the eye that is believed to be responsible for the progression of dry AMD or geographic atrophy. These two drugs and trials showed that treatment was able to slow the growth of damage that's associated with geographic atrophy. And there was some evidence to show that they're able to begin to slow the progression of sight loss that's also associated with late stage dry AMD. However, the trials also found an increased risk of developing wet AMD when patients were receiving treatment. So we're still waiting to hear whether these drugs will be approved in the UK or not. Stem cell therapy is another area of research that's being looked into. It's a very interesting area of research. It looks at replacing new healthy cells with to replace cells that have become damaged or have no longer working. So for AMD, we're looking to replace damaged or dead cells with new healthy cells to restore health to the macula, but the goal too is to restore some vision. These are in very early stage clinical trials, but so far some of the trials have shown that they're able to restore vision in some cases to us. So this is an incredibly interesting area of research that we hope continues to be developed. Some other hopes for treatments is treatments without injections. For many patients who receive injections into the eye, these intravitreal injections, they find them completely fine. They're very quick and painless. But for other people, that they experience some discomfort or some anxiety relating to treatment. So if we could have treatments that didn't require injections, such as eye drops or tablets, that's a really interesting area of research that many people are looking into. There are some issues with that, making sure we get the right dose without any side effects. But that's something that's being investigated by many different people around the world. Finally, there is really a lot of research going on around the world and in the UK looking to understand AMD better. At the Macular Society, we do fund research, and a lot of our research is relating to understanding the causes of AMD, why it develops and why it progresses, so we can hopefully find new treatments in the future. Research is also looking to better understand AMD, to understand who is going to develop AMD, early AMD, and who's going to, of those who have early AMD, who are going to progress faster to late stage AMD. One of the goals would be to find people with early AMD who are going to progress fast and find a treatment for them that could stop the progression of AMD before they lose any vision. This is still kind of something that's being investigated. We don't have any treatments for early AMD, but it's a goal for the future to be able to have a treatment that could be given before anyone loses any sight. Finally, I've been talking about clinical trials. There are opportunities to take part in clinical trials and research. As a Macular Society, we have what we call our research participant database. And you can sign up to hear about clinical trials, surveys, and focus groups to share your experience of living with AMD and to get a chance to take part in clinical trials for new treatments. Finally, I've got one more slide. I want to quickly talk about Charles Bonnet syndrome. I'm aware, I think we've already had a webinar covering this, but it's something we always like to mention. The Charles Bonnet syndrome, or CBS, is a condition that affects those with sight loss. CBS causes visual hallucinations, which range from simple shapes and patterns to vivid imagery of landscapes and people, and many other things in between. CBS is believed to be caused by a lack of visual signal being sent to the brain, leading to the brain to creating its own visions. So, people, as the brain isn't getting as much information from the eyes because of the vision loss, the brain is trying to fill in the gaps for itself. And this is how these visions and hallucinations occur. We like to mention this because many people don't hear about this until they experience the hallucinations. So being able to let people know what this is and to let them know that if they do experience this, it's a normal response of the brain to sight loss and can be quite reassuring to people. And there are different things you can do to help stop those hallucinations when they do occur. Something I always like to mention just so people are aware of what this is. So I want to thank you all for listening to me. I hope that has been informative for you, and I'm happy to take any questions you might have. Thank you.
Thank you so much, Sarah, and that was an informative presentation.